Good morning, everybody. Thank you so much for having us. My name is Christina Huebner Torres. I am the Director of Research and Wellness at Caring Health Center, and I am completing my doctorate in epidemiology here at University of Massachusetts. I'm presenting with my team and colleagues about Caring Health Center and our strategies for achieving health equity, both within the organizational level and through our practice. So Caring Health Center is a federally qualified health center in Springfield. We serve residents and refugees, immigrants, and we are a medically underserved area and provider shortage area. We primarily provide primary care services to adults and pediatric patients, along with many other services, behavioral health services, substance abuse, wellness services, and many others, including WIC. We are in the operations of trying to close gaps in terms of where people access their health care and how they minimize the barriers to the social factors that impede their health care. Our mission statement specifically is to promote health care for the ill, comfort the sick, and bring the highest level of care to those who are challenged by socioeconomic, linguistic, and cultural barriers. That last part is key to our work, serving over 16,000 patients a year. 52% require translation services. And as you can see, as the only and the largest refugee health assessment site in Western Massachusetts and the largest in the state, we serve to a very diverse patient population, and from a healthcare standpoint, have to understand both linguistically and culturally how to address the different cultural health beliefs and practices of the patients we serve and be informed by that community in order to do an adequate job, if not an excellent job. Based on our research at the health center, we know that we have patients with a mean monthly household income of just under $1,100 a month. Less than 40% have less than a high school education. Nearly 37% have inadequate health literacy. And about 40% are food insecure. We've heard a lot about food insecurity. This is important. The national average is 14%, with health disparities among Latinos and African Americans nearly doubled at about 22%. But in our population at Caring Health Center, we have 40% food insecurity across our patient population. And among African Americans and Latinos, we see double and triple that rate. So this is clearly a critical issue, issues of food. And interestingly, like the concept of diapers or food, we deal a lot of times with issues like medication or food, the concept of treat or eat. So there are several strategies. I'm going to name 4 that we use to address health equity, both from an organizational standpoint and then from a practice perspective. Number 1, our leadership is 51% consumer-led board of directors. As a HRSA-funded federally qualified health center, this is a requirement, and it means that 51% of our board of directors are patients of the health center. In addition, those patients that are representing the health center on the board are also representative of the racial ethnic diversity of the patient population. That means decisions that are being made at the health center are truly made by our patients. Our lead executive staff, for instance, are all women of color. Our management team is equally diverse, and that is true throughout the entire organization. A lot of times you'll see racial diversity at the more frontline type positions and much less diversity as you move through an organization into upper management. This is something that Caring Health Center has addressed with its staffing policies. As part of the executive strategic plan and the hiring policies at the health center, we are committed to offering opportunities and creating opportunities for diverse individuals who can fill those roles. So not just based on what credentials or degrees a person has, but the excellence and expertise and experience that they bring based on their life experience, not just in the United States, but from all over the world, actually. And by providing opportunities and filling those positions with folks who are very capable and very excellent in their work, we end up being able to mirror the patient population that we serve, which is one of the primary aims. It's also essential when you're serving as diverse a population as we are. Thirdly, workforce development trainings are critical. We have actually just been in the process of a collaboration with the University of Massachusetts in this effort, where we've developed a series of trainings, one of which specifically is around cultural competency from a cultural humility perspective. We've developed and implemented a culturally tailored program for our staff and had 3 waves of training go through staff, and based on the success of that, are looking to incorporate that training into our general HR orientation for all staff. And lastly, we conduct community-based research to address and identify barriers that are emerging in our community, to better identify the trends and opportunities for intervention, and to better understand the cultural health beliefs and practices. There are many things that may be well understood from a medical or public health standpoint, but they may not be universal in the way that people understand and believe, in the way that their experience of health or their goals towards health are represented. So having a clear understanding of what's meaningful to the patients and population that you're serving is critical. All of this at the health center is done first and foremost through a commitment to addressing things from a culturally diverse, linguistically diverse, and other diversity standpoints, LGBT-focused, et cetera. And secondly, we can't do it without the partnerships that we have. Many of our partners are in this room today. We partner in initiatives like Live Well Springfield and the Mobile Food Market. We partner with, like I said, the University of Massachusetts. So we have community academic and community-based partnerships that allow us to bridge our resources with the resources of others to achieve these things. And what I'd like to do now is hand it over to my colleagues to present 4 different ways, examples of the ways that these things play out in the way that we develop programs and services, and also represented within each of these departments that they're going to speak to, the items I have addressed, the concept of staffing them to meet the patient needs and to represent the patients we serve, the policies around how those departments are operating, all of those things continue to be at play. And just these are 2 examples of our culture humility training and members of our heart, health, and nutrition and culture training, all part of the project I was just mentioning. Our staff are able to get involved and participate in these things and experience some of the things we're learning and then pass those things on to our patients.
Hello everyone, my name is Gautam and I'm from Bhutan. You will hear a different accent now, okay? I am a community support specialist here at Caring Health Center, and we started building this department under the initiative of Christina, who is right here. She, under her initiation that he started off, I was the first person, but I'm going to tell you that within a year and a half, we have around more than 15 full-time staffs, and our primary goals are to provide culturally appropriate behavioral health services. As we have heard from other speakers also, that there is a huge fragmentation and gaps in the services. And basically, Caring Health Center, as a FQHC, we are forced to take care of all the patients irrespective of their income level. So behavioral health support is to prevent and manage the chronic disease among the diverse patient population, and we also provide culturally and linguistically diverse team and leadership. As Christina mentioned, we have not top-down leadership, but it's all bottom-up. We are on the same level. We try our efforts to get together and solve the patient's problems. Thank you so much. I had very little time, but I let me do a little bit marketing. We have a lot of openings there. If you want to do a licensed clinician and all research students, you can come and visit our site, www.caringhealthcenter.org.
I have to follow that. Hi, everybody. I'm Molly Totman. So I'm going to talk to you a little bit about some of our research that we have going on at Caring Health Center. And we're unique as an FQHC under Christina's leadership to have some great research partnerships in collaboration with the University of Arizona, the University of Massachusetts, and one of our research grants is actually, thanks to Alin, you're in here, with the Norwegian Council, which is an interesting one. So our first big NIH-funded study was in collaboration with the University of Arizona and Susan Shaw, who's the PI on the grant, and was looking at health literacy, cultural health differences, and health outcomes. And the result of that study led to our Wellness Center, which is something we're very proud of, and I think someone's going to talk a little bit more about that. But one of the big barriers that came out of that was the lack of safe spaces to get physical activity. So the Wellness Center was developed after that grant. And then our second and current study took some of those pieces from the first study and went further. So we're looking at medication adherence, health literacy, and cultural health beliefs. So we're in year 3 of year 4 of that study, and also part of that, we've been able to hire staff to conduct the interviews who are culturally and linguistically representative of the participants we're recruiting. So, and some of the initial findings, like Christina mentioned, are around food insecurity with 40%, health literacy nearly 40% inadequate, and other issues around barriers to care, including medication adherence, social stress, social support. So we'll continue to develop our findings, and we've already begun to develop our next action around what we're finding, which is the development of a CHW-led medication therapy management pilot program, which we're hoping to roll out in the next year. And I'll leave that there.